Dr. Maurya.
Good afternoon, chairperson, co-chairperson, and moderators, all speakers and participants. I am thankful to Dr. Namrata Sharma and Dr. Gangadhar for inviting me in first International Ophthalmic Conclave. My topic of presentation is ocular trauma, changing patterns and landscape. Ocular
Dr.
trauma.
Maurya, can you enlarge your screen if possible? Put the full screen option.
Okay, I'm trying, sir.
Can sure.
So my topic
sure.
is ocular trauma, changing patterns and landscape. Ocular trauma, once described as a neglected and underreported disorder, has recently been highlighted as one of the major causes of acquired visual impairment and blindness. Ocular trauma constitutes 7% of all bodily injury and 10 to 15% of all eye diseases. More than 1.6% people are blind due to ocular trauma worldwide. It has been reported that 90% of the ocular injuries are preventable. For the development of effective preventive strategy, proper knowledge of clinico-epidemiological pattern of ocular trauma is required. Epidemiology of ocular trauma varies from country to country, depending on the geographical location, literacy level, socioeconomic status, lifestyle, and cultural practice in the society. And these factors are constantly changing. Severity and pattern of ocular injury depends on the traumatic agent, circumstances, and mechanism of injury. Ocular trauma can occur virtually at any setting, at any age. Children are more vulnerable to ocular trauma. According to the annual report of NSBP India, the major cause of pediatric ocular trauma is sports and recreation related activities. Depending on the period of popularity, sports are traditional games like gulli danda, kabaddi, bow arrow, and modern games like cricket, hockey, boxing, wrestling. And depending on the anticipated eye damage, the sports are divided into low risk, high risk, and very high risk. The modern games are mainly high risk games. A young child having a gulli danda injury showing a rupture of the left globe. Another case of the penetrating injury caused by bow and arrow injury. Hockey and cricket is a modern and most popular game in India as well as in other countries. The famous hockey and cricket players have severe eye injury by ball. Here is a multiple oculofacial fracture with globe rupture caused by cricket ball. Pattern and severity of ocular damage depends on the velocity, size, hardness, and weight of the ball. Kite, that is patang flying, taken as an exciting and competitive sports, has tremendous popularity in North India. Kite flyers may sustain direct injury by kite string or indirect injury due to fall from height. Here is a cranio-orbitofacial trauma due to fall from height while flying the kite. Child was having a retained orbital foreign body, that is asbestos cyst, which was removed by multidisciplinary approach. In present scenario, excessive use of mobile phone and electronic gadget is emerging as a cause of ocular trauma due to accidental battery explosion. This child having polytrauma due to mobile blast. There is a traumatic amputation of finger and laceration of upper eyelid and cornea. The cornea and eyelid was repaired and foreign body were removed. The prevention of battery blast suggestion is never use mobile while charging. Avoid overcharging of your mobile. Ocular face hook injury is a common recreational human activity. Management of face hook injury is quite challenging and difficult because there is a risk of severe damage while retrograde removal of the face hook. Child having a corneal face hook injury, CT showing the face hook was in anterior chamber, which was removed by a vertical incision given on the entry side on the cornea. Another face hook injury of eyelid, which was removed by advancement and cut technique. SL2 violence has been increased twice within last 2 decades, and assault-related ocular injuries are often grievous in nature, and its prevention is very difficult. There is a case of orbitofacial trauma due to physical assault, showing multiple orbital fracture, which was repaired by titanium mini plate. The gunshot injury showing a double perforation of right eyeball. Another case of assault-related cranio-orbital trauma in a tribal person that was injured by a metallic arrow, which was removed by multidisciplinary approach by ophthalmologist and neurosurgeon. There is a changing pattern of war-related injuries. War injuries are multi-system mass casualties associated with high incidence of penetrating injuries, and heavy wound contamination is another dimension. There is a changing pattern in incidence of ocular injuries when we see from the First World War to recent, that is urban Israel war and Muslim countries war. They are showing increasing trends in the incidence of ocular injuries during war. There is a changing pattern of weaponry use in warfare. That is from machine gun and grenade. Now there is a automatic nuclear weapons, biological weapons are available. For management of the war-related ocular injuries, a coordinated, specialized, and multidisciplinary approach is necessary, and soldiers should be provided a good quality protective devices. Animal-related ocular injuries are mainly caused by livestock animals like dog, cat, and cattle. Wild animal attacks have now become rare. I have seen only one bear attack injury in my whole 25 years ophthalmic practice. This patient was having multiple orbital and orbitofacial fractures with laceration of the forehead, which was repaired with multidisciplinary approach along with the maxillofacial surgeon, neurosurgeon. And cow horn injury showing scleral rupture with phacocyl. Another case of cow horn injury with fractured posterior IOL, dislocated subconjunctivally, and broken haptics inside the anterior chamber was successfully removed. Dog bite wounds are always a complex in nature and difficult to manage because the dog carry number of germs in their oral cavity and risk of rabies transmission. This is eyelid avulsion due to dog bite, which was managed surgically. Another case of dog bite. Management of dog bite includes the aggressive wound irrigation, selective debridement of the dead tissue and scab, anti-rabies and anti-rabies immunoglobulins around the wound site, and wound repair, primary repair is preferred nowadays. Previously, it was recommended that secondary repair, but to get the better cosmetic result and proper wound position, we will try to repair dog bite injury primarily. Another is a newborn presented with me a history of cat claw injury just 1 hour after his birth, which was repaired and with some deformity. Another case of cow hood injury. Road traffic accidents have increased tremendously in last 2 decades due to growing number of vehicles, new drivers, congested and poor quality of road. The number of road traffic accidents increasing in almost all developing countries, including India. The road traffic related ocular trauma, there is a severe lid laceration and globe rupture. Patient was lid repair and globe repair was done. To give a cosmetic, we put the custom fit prosthesis. Road traffic related crust injury of the left eye and periocular area. The principle of management was anatomical identification, thorough debridement of dead tissue, proper approximation of the tissue, and repair by layer. Prevention of RTA-related injuries. One should avoid the driving under alcohol consumption, fast driving in night, overloading, use of mobile phone, eating or drinking, and smoking while driving. The domestic and agricultural injuries. This lady, a young girl having cooker vessel-induced injury. There is a laceration of the eyelid and total rupture of globe. There was no light perception. Another case of globe and lid injury with harvesting fan, and patient was managed. Message is never excise the globe, even there is a no light perception. Preservation of globe offers advantage of positive psychological impacts to the patient and his relative. The service recommendation uh, towards the ocular trauma, there should be a mass health education and spreading of awareness regarding the risk of ocular trauma, morbidity caused due to delayed presentation, and need to adopt safety preventive measures like compulsory wearing of appropriate protective devices, safety goggle, helmet, seat belt. Primary healthcare providers should provide initial treatment as early as possible and then refer complicated cases immediately to the nearest tertiary care center. Early and meticulous repair may give good visual outcome. Government administration can play important role in prevention of ocular injury by imposing strict rule against the assault. Prevention of assault-related ocular trauma needs modification of violent behavior, resolve the conflicts as early as possible, strict control over alcohol, illegal drug use, and legislation limiting the proliferation of firearms and weapons. Multicentric study would provide better insight to the problem. That is research recommendation. In order to find out the efficacy of treatment outcome, vigorous monitoring of outcome parameters is required in prospective manner. Therefore, a prospective study is another aspect may be taken for prevention of ocular trauma. Thank you.